in Ireland, that green is much bigger, I know. But in the US, it's backwards. Too many specialists, too many consultants, not enough GPs. And I said, okay, how about this? We're spending 4%. This is Vegas. Let's double down on primary care or triple down. And let's really spend properly on prevention, and then let's change everything. And the result of that was this: Turntable Health, the clinic we built in the heart of downtown Las Vegas. This is our team. And the way it works is this. We said, okay, my dad pointed out clearly that the US healthcare system, which is fee-for-service based, pays you to do things to people instead of for people. Well, hey, what if we make it a membership model, like a gym, where for a flat fee, you get all you can treat access to the buffet. And that then takes away all that negative incentive to do more. And the truth is, the government, individuals, businesses, all of them can pay the fees on behalf of the patients. So it's very different than concierge, where you're charging a patient a ridiculous amount of money to have access to a doctor whose sole goal is to keep them happy by giving them whatever they want and ordering whatever they want. Instead, the goal is to keep them healthy because we're accountable to the business, to the individual, to ourselves. It's very different. And by doing that, we open up the care model for innovation. So now, Andrew here with the tattoo of his daughter is a unique player in this game. He's a health coach. Earlier in the day, during the panel, someone asked, how do we in a 10-minute visit listen to our patients, hear them, be present for them? It's impossible to do, but it's really not, because we talked about it. Well, if you leverage the fact that probably 60% of what we do in a GP's office can be done by someone without a medical degree, but who has a little something we call empathy, you can then empower the physicians to operate at the top of their licenses, and the patients get an amazing experience where they're heard and their story is unfolded. Andrew is a paramedic in nursing school. He is also a bartender at the Wynn Resort. We screened 500 people to find 2 health coaches based on empathy, their ability to get stories out of people. And they are sort of entry level. There are 4 of them to every doctor. And they can room a patient for 30-minute minimum visits, which is our minimum visit length. And the doctor can go from room to room, really coordinating and connecting. And they don't have to do the heavy lifting and the blocking and tackling that isn't in our sort of medical space. And so this is incredibly empowering as a medical model. The second thing that it does, it allows a team-based approach. So you have the health coaches, then you have Nina, who's our licensed clinical social worker, who in the US does mental health. And so she is able to dig into the real root cause of so much illness and suffering. And it also happens that she's a yoga and meditation instructor. And it also happens that we built a yoga and meditation studio in our clinic. And so she can identify people who are the most anxious, who are the most likely to benefit from this, and then teach the classes. And they're all included in the membership, unlimited. That is interesting. And she can go back to the doctor who's across the hall and say, such and such really benefited from this. One of the things I noticed was this. It's very integrative. And if you look at the design of our facility, this was an early rendering of just the concept. This idea that you engage the community, the entire 100-acre woods, as it were, and you bring them in and you welcome them into a place that does not feel like a place for the sick, but a place for people who want to be well, who are welcome even when they are well, so they can stay that way. But the most important part of the model is here, the doctor and the patient, in this sacred space that, if you'll notice, has no pokey stuff. And if you'll notice the electronic health record, which we built from scratch because all the other ones were rubbish, we built it from scratch to be read by patients, to be written in by patients, to be a narrative unfolding, to do population health on the back end, to identify people who we assign a worry score, who we're scared will get admitted in the next month, who we can proactively reach out to during the huddle when the whole team comes together to talk about not the patients who are coming in that day, but the patients who aren't, who we're concerned about. In this sacred space is where the next evolution, I think, of healthcare should be.